The most common cause of stroke occurs when there is occlusion of a major artery in the brain that blocks the blood flow. To begin with, one must understand that nerve cells transmit their message in the form of a signal, which is an electrical signal. One of the major neurotransmitters that is involved in transmitting this signal is a neurotransmitter known as glutamate. This is the most abundant neurotransmitter in the nervous system. However, this neurotransmitter, which is tightly regulated in the brain, when there is injury to nerve cells, it is released in abundance, okay? And what it does is that it overexcites, it overactivates neurons to their death. And this is exactly what happens during the very early stages when there is a stroke. What we discovered really is, we discovered that the main source of damaging glutamate that occurs during a stroke arises from nerve cells rather than from support cells, as was historically documented. So this was a great finding for us. Once we identified the type of receptors operating here, we then went through several databases to find whether we could find a suitable drug that could block these receptors and therefore prevent this type of injury. In fact, we came across a drug known as QNZ46. What we discovered is that when drug QNZ46 is applied to the brain, it protects the brain in full. So, in the middle section, you see serial sections of the brain without drug treatment. In white is the infarct. It is the area which has been injured. And the red is the viable, intact tissue. So that is what happens during a stroke. With drug, there is total protection. As you can see, there are no white areas except for a small patch in that section of the brain. This drug, per se, would therefore be very much suitable to people who have a very high risk of having a stroke. It's suitable for people who have a very unhealthy lifestyle and who are not taking any medications, for example, to safeguard their high blood pressure or to safeguard their very low inactivity or obesity.